you for joining today's educational webinar with Cancer Support Community Los Angeles. I'm Abby Espinoza, the Program Coordinator at CSCLA, and I'm honored to welcome you to this week's webinar titled Fueling Recovery, Nutrition, Exercise, and Wellness During Treatment and After Cancer. Before we begin, if this is your first time joining us, Cancer Support Community Los Angeles is a premier nonprofit organization providing vital social and emotional support to families facing cancer, including patients, caregivers, and their loved ones, all at no cost. Our programs include support groups, healthy lifestyle classes, social activities, and educational programs such as this one. If you would like to learn more about our services or watch past webinars, please visit our website at cancersupportla.org. Before I introduce today's speaker, please note that your video and microphone are automatically disabled for this webinar. Please enter questions for the speaker into the Q&A feature found at the bottom of the window. Questions will be answered at the end of the presentation. We may not be able to get to all of your questions today, but our presenter will get to as many as possible. Please use the chat feature to share comments and resources with other participants or to ask questions of CSCLA. We ask you to limit chat comments to information relevant to this topic. Matthew Lee is an assistant professor in the Department of Medical Oncology and Therapeutics Research at City of Hope in Duarte, California, specializing in lung cancer, including small cell lung cancer. He is dedicated to providing compassionate, patient-centered care and developing personalized treatment plans tailored to each patient. Dr. Lee earned his MD from State University of New York Downstate Medical School, completed his internal medicine residency at Northwell North Shore University Hospital, and trained in hematology oncology at Montefiore Einstein Comprehensive Cancer Center. He also holds a Master of Public Health and Epidemiology with interest in public health, socioeconomic determinants of health, and real-world data utilization. It gives me great pleasure to welcome today's speaker, Dr. Matthew Lee.
Great, thank you, Abby, for that wonderful introduction. It's great to meet everyone here on the webinar, and happy to present this presentation and happy to take questions afterwards. Just slide. Okay, great. So, this presentation is based on nutrition, exercise, and wellness, actually. So it's a pretty broad topic, but I think it's an important topic that, sometimes even as providers for medical oncology, it can be difficult to, figuring out, what is the best ways of trying to educate and also raise awareness of different techniques and different recommendations that we would have for patients who are undergoing treatments and even after treatments. So no conflict of interest for this type of presentation. So the outline of this type of talk would be really based on, like I mentioned, nutrition, recovery, prevention, exercise and wellness, and even survivorship. So nutrition in cancer has played a pretty big role. A lot of my patients ask me during the visits about, what are some specific type of nutrition type of guidelines? And it can be a little bit tricky at times where we, don't have the best evidence data or clinical trials like we do for our treatments. But really, there's a whole wide range of different information about how different diets can try to actually help, help with the different types of inflammation, oxidative stress, and also the immune function of patients undergoing treatment. So the broad general diet plans that a lot of patients and doctors see about is, having it rich in vegetables, fruits, whole grains, legumes, and nuts. We'll go into, other specific type of dietary type of plans, but another background is that unfortunately there are a growing number of cancer patients that we are seeing each year, and about even 2 million new cases each year. So it is a problem that we are all trying to face together. So one of the strongest type of researches that has been out there is actually trying to relate cancer and weight and BMI. So actually over 10 different types of cancers have actually been linked towards actually overweight and obesity. Really the highest risk is actually endometrial cancer, and next is esophageal, gastric, breast, colorectal, kidney, pancreatic, liver, and so forth. So what this link is actually due to a couple of factors. One is a hormonal type of pathway, which a lot of these prior cancers that I mentioned actually are acting on hormonal pathways. And unfortunately, with increased amount of fat cells, what happens is that there's an increased amount of estrogen, insulin, growth factors, and inflammation that all combine together to unfortunately causing cancer type of not only incidence, but also progression. But also there's an opposite type of research that we have also been seeing where there's cancer in low weight, actually, and low BMIs. And really, it's unfortunately when you're undergoing treatment or you're having, advanced cancers, is that, a lot of patients also note that they're not overweight, they're actually losing a lot of weight. And that becomes a big concern. And there is a phenomenon called cancer cachexia or sarcopenia. And this does happen to also an impaired immune function. There's also reduced activities, low food intake, low PO intake, and also muscle weakness. This has all led to, unfortunately, increased toxicities, postoperative complications, and just overall diminished quality of life. So really, this is also another strong evidence type of data where we have had also the opposite, where we've seen actually low BMIs also causing increased type of complications when patients are also undergoing, treatments and afterwards. So this is just a visual schematic of, also this phenomenon of the cancer cachexia and what the different types of signs and symptoms that unfortunately can happen and, are related to what we also see. And, some of the different types of treatment modifications that, we'll talk about a little bit. But the focus of trying to also seeing how we can tackle this. I also wanted to go over a couple cancer diet myths and that I've seen and heard about when patients ask me about. One of the most common ones is about sugar and if it actually feeds into cancer. So that technically is a myth. There's not really strong data of that particularly association. It's really, even if patients are cutting out carbs completely, it actually does portend them into that malnutrition type of um, factor where I mentioned about the cachexia and the sarcopenia. And really, the focus should be on trying to have a balanced type of diet. And I'll be mentioning that multiple times during this presentation, but it's really trying to also focus on healthy carbs, whole grains, and vegetables. Alkaline diets cure cancer. There's no real evidence for that. So, some of my patients have asked me about whether they can try to titrate, their pH and seeing if they can eat different types of foods in that sense. There's not really any evidence that either an acidic or an alkaline type of diets really are either detrimental or actually curative. Um, there are some patients who, they ask me if they need to go completely vegan. I personally think that is a preference choice if you're going to go vegan or vegetarian, but I would not say that, fortunately, if you go vegan, that would definitely be as most protective. I think there are definitely benefits for vegetables and, having a balanced diet, but if you go completely vegan, there's also nutritional deficits and that are not part of a protein-based diet that sometimes some of the treatments actually do require that you have to have, a balanced protein supplementation too in that sense. And then also a lot of questions about supplements and nutritional supplements. And it's unfortunately is a not as regulated field compared to the treatments that you get for cancer. So in terms of do supplements actually cure cancer? These are unfortunately, it's a very difficult way to navigate with everything that's online. But as a medical oncologist, a lot of times I have to tell patients that, these supplements are not studied in a rigorous type of clinical trial. So they're not known to actually have either harm or benefit. So, it is with, advice from your doctors of figuring out what kind of supplement you want to take and what you're actually getting for treatment and which ways we can try to balance out and figuring out which ways we can also help out in that sense. So nutrition and treatment, it does actually vary. I think the audience here today has, various types of cancers. So, every different type of cancer has a different type of treatment, and every patient is unique and different in the sense of how they would react towards it. But these are very general, broad, side effects that we would see, and also, how does nutrition really also affect this? Um, like I said, the treatments can vary, but really the way that nutrition also affects is it's pretty broad, and it covers most of how we also try to deal with each type of different treatment side effects, either skin changes, hair loss, fatigue, even the nausea, vomiting, the GI type of side effects, the immune system. A lot of these are all interconnected. Interestingly, there's actually a lot of new studies coming out about also our gut microbiome in cancer. There's nothing just yet in the clinical um, trial sense of trying to using it as right now as an FDA approval, but there are a lot of studies and research actually ongoing in looking into our own microbiome and how that actually affects the way that we do treatments and efficacy of those type of treatments. So like I mentioned, there are, unfortunately, a lot of side effects that do happen with a lot of our treatments that we give. There are some very, broad general type of um, recommendations that sometimes I do have for patients. Some of the more common ones, especially for treatments that I see with lung cancer, diarrhea, having the mouth sores and taste changes and nausea. And they really do vary, and it also, again, is dependent on the patient of how they're going to try to balance it out. There have been, trying to change to low fiber type of diets, or trying to use non-acidic type of foods, avoid spicy type of foods, or even trying to even change what kind of utensils you use for, let's say, if you're having taste changes from actual chemo. So there's a lot of different ways of trying to figuring out which route we're going to use to try to see about, helping out with these side effects. But these are some of the more broader, general ones I try to, advise patients to trying to do. This is, again, some just healthy broad tips, and this is from the ACTC, which is an Advanced Cancer Treatment Center. And it really does show, quite broadly, just simple steps of how to deal with recovery and during treatments. Sometimes some patients prefer having a smaller frequent meals compared to just 3 big meals if they're having a really severe nausea and vomiting, and they're trying to keep down with, the medications that we try to give them. Um, again, that balance of protein and, trying to making sure that you still have, enough nutrients and calories to going through your day, because again, fatigue and managing all these side effects can be quite difficult. And really, actually, to be honest, also another aspect that I do try to emphasize is trying to stay hydrated. Unfortunately, yes, if you're undergoing infusions or going for chemo, we give a lot of treatments by IV, but actually the most healthiest way of keeping fluids and having, patients really try to get through it is actually taking fluids by mouth, not normally just through IVs at a time. And also, importantly, food safety, just making sure that you're washing your type of vegetables, avoiding the raw meats and raw eggs and seafood. Another important topic is exercise in cancer. And there's actually been a lot of data recently that has come out about this and actually showing even mortality type of reductions with actual physical activities and exercise. And this is all related to not only trying to strengthen out your respiratory and cardiac fitness, but also reducing treatment-related toxicities and even fatigue, numbness and tingling in your hands and feet, and then also even some of the cognitive impairments that can happen. So this just came out in our big type of cancer conference called ASCO. And this was back just last month. And this was in the New England Journal where they actually looked at a structured exercise program after adjuvant chemo. Adjuvant just means after surgery. And basically they looked at this very large, multi-centered, over 8 to 10 years, with over 800 patients who had these colorectal cancers that were resected and got chemotherapy, but they actually were randomized also to either a structured exercise program or an health education materials type of program alone. And really, this intervention group was pretty intense. They had these monitoring sessions in 6 months, 12 months, and 2 years. And basically, they emphasized this exercise type of sessions where they actually had a physical activity type of consultant. But I think the main goal of everything else was is that they really were trying to get patients who, are an average patient who was not really able to get to the point of doing, aerobic exercises for at least what they call METs or the metabolic exercise equivalents, but really to trying to seeing if they can try to do that in a structured way of slow and gradual. And on the left, I actually have some different examples of how we measure what we call METs. And, either even just as something as, doing chores like, cleaning your house, gardening, washing your car. There are different little workouts or little different ways of increasing your exercise capacities to the point where you can actually meet where they were actually in this type of trial. So why I emphasize this is because what they really did see is that if a patient was able to start going up to at least for one of those type of, low intensity type of exercises, at least for about every day or about 5 days a week, where they can actually try to increase their activity output, they actually had seen up to 30 to 37% really a relative risks reduction in their disease recurrence, even new cancers popping up, or even death, and even showing a overall survival difference between patients who in the control group, they were just given health information through pamphlets and just advice. But in a structured group, they were able to actually have this difference of up to 7% in their 10-year follow-up. So interestingly, actually, the authors, even in this trial, actually said that the magnitude of the benefit of the exercise delivered after surgery was actually similar to even some of our adjuvant chemos that we do give. So a lot of us medical oncologists were very surprised, and we were also happy to seeing something like this actually being presented and being published in such a well-recognized journal. So I think what I wanted to emphasize is, from this new research that we just seen from last month, is that, every patient, again, it's different. It depends on where you're at in your cycle of treatment, how much you're really doing in the beginning and how much were you doing before. But really what I try to do is, you do have to individualize it, and you have to start slow sometimes, and then you just modify. It is different things of different routines that patients are able to be comfortable with. And it's not a one size fits all. So, I think what this graphic on the left from Andy Anderson really shows is that there's various different types of exercises that you can do that don't require any sort of gym equipment, and really just starting out even in short chunks of like 10 minutes and seeing how you do. There are recommendations out there about 150 minutes per week in resistance training. Again, I think, it is sometimes difficult even for even healthy patients to do 150 minutes per minute, but I think it's the slow, gradual, uptake and trying to see how much you can tolerate in that point. Um, Another aspect of this is, since I know that's some of the participants right now have gone through all the treatments and now they're in the survivorship phase. But really, after going through all the treatments and everything else, still a lot of what you do now is just trying to hopefully prevent any sort of risk of recurrence or any other type of chronic diseases that might come up. So really, some of the research has focused on actually survivorships for breast and colorectal cancer, of trying to really having that healthy diet type of pattern and exercise that has shown to have those prolonged benefits, just like how we've seen from those patients who had that surgery and then that structured exercise program. And then also keeping in contact with your doctors and making sure if there's any sort of different changes in your symptoms that are new. So really just putting it all together, and it's a very broad type of um, overview of everything else. It's really about balanced meals, trying to, having daily type of movements, this wellness of, mindfulness, and really small steps do add up. So these are some of the resources out there. I would highly recommend checking them out. I think they're great. Technically, I am not a oncology dietitian by practice, but I think as a medical oncologist, it is very important to at least understanding and knowing about how diet does affect our patients. And also, one last thing is an integrative oncology. Sometimes there are aspects of medical oncology that we have with allopathic medicines, but there are different ways of different lifestyles, meditations, yoga, acupuncture, that have been known to really help our patients get through treatments and also some of the side effects also. Great. And this is a picture of the LA Marathon, and just like it's just an analogy of, when anything with cancer, it really is the marathon, like trying to just take it one step at a time. All right, thank you. I think we have time for some questions.
Thank you, Dr. Lee. Yes, we did receive a question in the Q&A chat, and if anyone has any questions, please feel free to put them in the Q&A, and we will get to them. So someone is asking, do antioxidant-rich foods inhibit the effectiveness of chemo and radiation treatments?
Yeah, it's a good question. There's nothing that says specifically that it would. So, normally and turmeric is actually an interesting one that you also put in there, because there has been data in the past with like using turmeric for other type of diseases too, looking at anti-inflammatory and even Alzheimer's at a point. Um, I would not specifically advise that you need to stop it. I think the main point is that you really should try to have a balanced diet still, though. So I don't normally tell patients that you need to stop it during that time. I do when you're undergoing chemotherapy and radiation, or a combination or separate, it can be intense and your immune system does go down. So if the vegetables or the fruits or the meat are not cleaned, sometimes that can cause infections. So that's what I would be more concerned about.
Thank you. And then someone else is asking, is juicing fruit and vegetables good to have every day?
I don't think it's harmful. I think, again, the juicing part of it, it's not, it's more like if you're only relying on juicing and you don't have any other sources of nutrition. I think that's where it becomes a bigger issue sometimes, because if you're only juicing and you're not balancing out your diet with other type of proteins and carbohydrates, that's when I have seen patients, unfortunately, go to different ways in their, labs when I sometimes see them, either with their sodiums or albumin and protein that sometimes can actually be affected, not just by your diet alone, but actually our treatments sometimes can cause those abnormalities. So the best part of just trying to making sure is just making sure it's in moderation, or just not that it's your only source of diet.
Perfect, thank you. And someone is asking if a referral for PT is something they should ask for during recovery.
Oh, I'm sorry. What was that? It was about PT?
Yeah, is a referral for PT something we should ask for during recovery?
Yeah, it's a good question too. I think, PT is physical therapy. It depends on your oncologists and your doctors. It is not always it's not always something that we are able to do regularly due to insurance, because sometimes physical therapy is mainly for, let's say you had a recent hospitalization or disability where you can't walk as well, or you're having like a physical limitation. Um, it's if you're only going undergoing treatments, you could ask your doctor if it's possible, but my main concern is that sometimes insurances don't always cover it just for that and sole reason. So it might be difficult in that sense, because usually a lot of times our patients are getting physical therapy because they had like, a hospital admission, they're very debilitated afterwards, or they had some sort of orthopedic type of intervention. So, but I think it wouldn't hurt to ask. But those are sometimes the limitations of insurance companies.
Someone else asks, what helps neuropathy in feet after chemo? Is it acupuncture? Do you have any recommendations?
Yeah, no, I didn't mention it specifically here, but unfortunately, there's in terms of not having medications, acupuncture actually, I didn't mention in this presentation, but it's actually one of the ones I've actually have recommended for neuropathy. I do think it actually does have some beneficial effects. It is just, unfortunately, sometimes it's not completely covered by insurance. There are certain, um, you know, uh, recommendations for neuropathy of like avoiding cold, like foods and drinks like that. But in your question about like in the extremities itself, there's not a particular diet type of um, recommendation usually for the neuropathy. It's more about avoidance when they're talking about like if there's neuropathy in your hands and feet too. Yeah.
Thank you. And someone asked, is it okay to eat soy foods like tofu if you have had breast cancer?
Um, yeah, no, I don't think there's any sort of, I haven't seen the data about soy food causing particularly an association with breast cancer. Um, so, I don't think there's where I would say it's contraindicated where you can't eat soy foods like tofu. So I think in that sense that's not you shouldn't worry about that part.
Thank you. Um, and another question is, if people are making smoothies with frozen fruits slash veggies, do you recommend they wash their fruits slash veggies before putting them in the blender?
Yeah, I personally would still. These frozen fruits and vegetables, they are coming from different sources. Again, it's also dependent on how they freeze them and things like that. I would still try to, it's still as a safe practice to just wash your fruits and vegetables before you start eating them.
Thank you. And what are your thoughts on glutamine for a neuropathy?
Yeah, I have seen mixed results from it. I have in the past also recommended. It's a supplement. Um, it's there are some patients who do benefit from it. It is not a guarantee that will help, but there's the glutamine is actually based on the nerve systems and how they basically activate, and they're trying to see if it helps with that. Unfortunately, it's not a surefire way of helping, but there has been studies on it. Um, if your doctor is okay with it, I mean, obviously talk with them first about it. But that potentially is something I have used in the past, but it hasn't always worked, to be honest.
Perfect. Thank you.
Yeah.
Um, and then is there anything that would help with the effects of chemo brain?
Yeah, I think one of the things is chemo brain is it's actually multifactorial. Um, it's also dependent on what treatment it is and how long you're getting the treatment and what your cancer status is, of whether you had cancer in your brain too. Um, there's not a diet type of thing. I think actually a lot of what has been focused on in the past is actually um exercise and meditations and wellness in that sense. Um, Sometimes if it's really bad and you're having a lot of issues with it, I have patients doing, mental type of exercises and games and trying to keep their brains still active while they're undergoing so much of their treatments. But sometimes it's just unfortunately just the only way to help it is this potentially even reducing some of the treatments. Again, that's going to have to be a really, it depends on how severe it is and a discussion with your doctor. If you really can't, manage or you're forgetting things and it becomes more detrimental to your quality of life.
Thank you. And then someone is asking, what seems to be an ongoing issue is physicians not recommending diets, but then stating that one has to eat healthy. Um, how how can one really make educated decisions regarding this?
Yeah, no, I think the main thing is this. Because the thing about, you know, the eating healthy portion of it is just that there's no surefire way of controlling what exact portions you're eating. There actually has been a lot of good data on Mediterranean diet, and actually it's not just for cardiac, but for cancer itself and decreasing inflammation. So, that's more of a specific dietary plan. Again, it's hard because sometimes not everyone can eat that type of diet, and some patients have different preferences on what they're eating. So it's actually very individualized at a point. Um, I think it is difficult when you're out there and you're trying to figure out what kind of diet you really want to try to do. And that's why in this talk, I didn't specifically want to pigeonhole to different ways of it, because I think everyone's going to be different on how they're going to handle what they want to eat. But I think the message is trying to just be as balanced as possible, because if you try to do one way or try to focus on one aspect of it, it might crowd the whole entire overall aspect of your cancer type of treatment and care.
Perfect. Thank you. And someone is asking if chemotherapy and radiation, for example, can adversely impact the integrity of the stomach lining and stomach acid production is low. How does one build stomach acid up if the hydrochloric acid tablets are not safe nor the alcohol-based ap apparatives?
Yeah, I'm guessing so not every cancer treatments are going, directly towards your gastric or your stomach. So if it's, let's say if the unfortunate case is if you have gastric cancer and they're trying to do either chemotherapy or chemo RT in that area, yes, the lining can be specifically affected. Um, in terms of where we're at in terms of how we try to make sure that you don't feel any of these big side effects. Also depends on how much your intake is and what's the treatment plan of whether they're also going to go for surgery. I think as everything else, there I would probably, talk to your medical oncologist about how that's going with that treatment. Um, and also whether if it is truly damaging and causing inflammation in your gastric lining, that, acidic foods can make that a little bit worse. So avoiding spicy foods was, kind of one of those recommendations I also had for um trying to deal with some of the side effects. Probably would help a little bit. I wouldn't say it's going to completely eliminate it, even if you do even eat regular foods. Unfortunately, your stomach is still going to produce the gastric acids to breaking down your food. So that would be, unfortunately, one of those aspects. Sometimes they can give you medications to reduce the acid so that you can try to eat a little bit better too before you eat.
Thank you. And a follow-up question to that is, if stomach acid production is low due to age, cancer treatment, and or other reasons, and the stomach lining is thin, wouldn't eating animal proteins actually require a lot more acid to break those down and be contraindicated?
Yeah, so when you're eating, it's actually a little bit different in the sense that sometimes there's different enzymes of how we break down foods. So it's not only just based on acid in your stomach, actually. A lot of times actually base it on different enzymes that's coming out of your pancreas, trying to seeing how you can break down all the fats and the proteins. So there's actually it's a pretty complex array of different things that actually happen when you're eating food. So it's not just the acid actually. So again, I think it also depends on, where you're at in terms of treatments and cancer and where it's actually directed towards. I think the prior question sounded like there might have been getting maybe treatment more directed towards their gastric potentially. But like in general, actually, it's actually not just the acid, actually. It's actually based on a bunch of different enzymes.
Thank you. And someone is asking if there's no desire to eat, what are the strategies used in hospitals and that people bringing food can use to stimulate that desire to eat again? They've heard
Yeah,
of
I think
use.
it's
Yeah.
yeah, no, it's a tough question in the sense that this is very common that people are not able to eat or they don't have the desire to eat because, unfortunately, one of those aspects I mentioned about with the cancer cachexia, where the cancer is, either advanced and, it's eating up a lot of, the nutrients. Um, One of the things that I do recommend is just that, if you're really not eating, especially it seems like this question is more about if you're in the hospital, um, the hospital food is, it's not great, for the most part. That yes, if you do have food that you're used to or you're used to eating at home, I think that's perfectly fine. Um, there are a lot of us in the medical oncology sometimes use appetite stimulants. It's very hit or miss if they work. But sometimes patients have told me that, incorporating different salts and different spices and different sauces can help out a little bit, especially if they're having these taste bud type of abnormalities at times. Um, but it's very variable. And again, unfortunately, it is dependent on how you're feeling and what your preferences are.
Thank you. And then someone's asking what foods, herbs, and drinks can help build mitochondria and energy reserves and body's energy when there's just no physical energy and becomes an urgent thing to prioritize.
Um, so I don't know if the mitochondria and the energy reserves might be if you're referring to like sugar and ATP. which is what mitochondria really does. Um, it's kind of you know, a question about, yes, you don't have enough um, energy and you want to try to just build up energy, basically. I think this is, again, I think it's actually similar to some of the other questions also in the sense that, you're trying to figure out what is the best way of eating and trying to figuring out what foods are best for you. Um, there are no specific silver bullet foods in the sense that this food will definitely make you, feel better, and this one will, because if it works for one patient, it doesn't mean it will work for you technically. So that's why it's always been, difficult to saying that one regimen will always work for someone else. So I think it's similar to the other, question also of like if you're in the hospital or if you're not just feeling well. Um, things that really have helped patients are, foods that they're familiar with and foods that they have liked in the past and that, they like to try to eat. Um, Sometimes I tell patients because, they're going through so much already that you can try to focus on the foods you like. And, you don't have to necessarily always have to be calorie counting or trying to figure out, what exactly is happening. And then trying to see if that at least gets you to the ability of eating. Um, I would probably start out with that first, seeing. Um, Personally, I think a diet of like vegetables and fruits are usually the first way of starting, and then you can add on proteins later. Um, but again, it's a preference. Not everyone wants to do that. And but I think those are some of the, try to ways of figuring it out in that sense. There's also supplements out there like Ensures, which a lot of our dietitians here also use to try to help boost up patients' energies if they can't tolerate, regular food.
Thank you. And then we also received a couple questions at registration.
Yeah.
Um, do you think that organic products are worth the extra money?
Uh, yeah, I guess it depends. What is the organic product probably. Yes, there are some organic products out there, and there's a lot that there's no clear correlation of it being technically better other than it's processed in a different way. There's also some issues when you're labeling things as organic and how they're getting sourced, um that makes it really tricky. So to be honest, sometimes it's not just being organic, but it's also just making sure that you can eat. Because sometimes that's the hardest part. It's actually just having that process of it. So if you're trying to decide which one you want to do, I would probably at least pick the one that you think you feel the most comfortable with, but probably at least you'll eat it. And not just focus on the organic aspect of it all the time.
Thank you. And then someone else asked, how can one best deal with weight loss after treatment?
Yeah. After treatment and then trying to figuring out how to, especially with that trial, actually. So the one that I mentioned about the colorectal trial where they were doing exercise after, they actually had some dietary pamphlets they were also giving out. And again, it actually emphasized a lot about this. You don't need to like start, going to like a lot of buffets and trying to stuff your face with a bunch of food. It's really trying to emphasize again this balance approach, and trying to see how gradually you can get back up. Um, and I think that's one way of thinking about it because there are, people who complete treatment are, now in remission or they're, just trying to see how they can be on surveillance. Um, but I feel like that sometimes there's a shift where you can go a little bit too far. If you're overeating at a point and then there's other comorbidities that can happen that are not just cancer related.
Thank you. And we received a question during registration, and this is from a healthcare provider perspective. But they're asking, what should we educate our patients about regarding food choices?
Yeah, no, I think the main thing is in terms of the food choices is that um like I mentioned, it's actually not about specific recommendations in the sense of if it's an overall food choice, it's not about the specific recommendations of like you need to just only eat protein, you didn't only need to eat vegetables. It's more about this, trying to making each side equal in the terms of their portions and taking it also gradually at a point. Because unfortunately there are also overeating type of syndromes after you're underweight and then you try to gain a lot of weight, that can actually be dangerous too at that point. Um, but it's more of a gradual approach. Like I mentioned before, there's been datas on different types of diets, like keto diets and Mediterranean. So it's never been studied, unfortunately, in a trial. So it's not something that will be somewhere where we can say this is definitely the one that we would go for. So there's recommendations on the type of side effects of if they're related to the treatments, but there's not a specific diet, unfortunately, usually.
Thank you. And someone in the chat asked, they said they completed chemo last July, but have noticed that they can no longer tolerate certain foods such as eggs. They cause stomach pain for some reason. Do you think this is something that happens? Or sorry, is this something that happens, and is it possible that with time it will be tolerable again?
Yeah, again, I don't know what chemo it is. I don't know what cancer it is either, but it's, it depends. Or if you had other treatments or if the cancer is related to the GI tract. Um, Over time, what I have seen is that patients do recover, especially in terms of their tastes. It's usually not permanent, but unfortunately, there are times when, you know, it could still be long lasting. Um, Eggs, I have a feeling, I don't know if it's related to how I mentioned about enzymes and how they break down different foods. So that can sometimes make patients not tolerating certain foods in that sense. Um, Unfortunately, there's no magic type of bullet of trying to making sure that helps a little bit. It depends on what's the underlying cause. And if it's the chemotherapy, if you're done with the chemotherapy, it should eventually go away. But if it's not, then that's a bigger issue at that point. But I think it could take time, unfortunately.
Thank you. And then just going back to the topic of sugar, someone asked, you had mentioned whole grains, and they're wondering if that could spike blood sugar and create an issue.
Yeah, so there's a lot of sugars out there. It's a lot of processed type of food, and it's so sugar is not, unfortunately, it's not a monolithic type of like type of category. So I think one of the things is that whole grains compared to other types of grains and other carbohydrates, um, it's been found in the past of not being as processed or also as not as pro-inflammatories compared to other ones. Um, the reason about how we have to think about sugar and also how it creates an issue is more about whether it makes you into this metabolic type of syndrome and also this pro-inflammatory state and diabetes and things like that that can affect, unfortunately, down the line, sometimes how your body is, your cancer is dealing with it. That will be the bigger issue if it tips you into more of a diabetic type of range. So again, sometimes people eat a lot of carbohydrates based on their diet, and then all of a sudden they go into um, a diabetic type of range, and they're trying to avoid other sort of type of type of products. So that actually makes it harder in the sense that if you become into that issue with diabetes and but metabolic type of syndrome.
Perfect. Thank you so much. Thank you, Dr. Lee, for taking the time to be here with us today. We really enjoyed your presentation, and thank you for answering all of our questions today. We do have one final closing slide, Kathy. Do you want to go ahead and share that? Thank you so much for joining us, everyone. So if you would like to learn more about Cancer Support Community Los Angeles, please visit our website at cancersupportla.org. And if you have any questions, please feel free to email us at info@cancersupportla.org. Dr. Lee has also graciously agreed to share a copy of the slides. So if you would like a copy of them, please feel free to email us. We also wanted to share about one of our classes that we offer. We offer in-person strength and stability training. It meets on the first Wednesday of the month at our CSCLA location, which you can find on the slide. If you would like to register, please feel free to scan the QR code. And again, thank you everyone for joining us, and thank you, Dr. Lee, for being here with us today. And we hope to see you all at a future webinar. Thank you, everyone.